So today's YouTube, basically we had to complete the fever, but there were a lot of questions, so I could not complete it. Let us start with questions. A lot of questions on the WhatsApp and the Facebook. So if you don't have any questions now, we can start with that. Yes, anybody with the questions? People are live now, and somebody had asked me something about the remedy about ammonium carb, and yeah, hello, Dr. Babel. Something about ammonium carb. Now, see, whenever you are prescribing ammonium carb, yeah, Dr. Amit, good afternoon. So it is very important to understand that ammonium carb is not, hello, Dr. Alexander, is not only a remedy only for that cough, snuffles of infant and cough of old people. It has a lot of variety and range of action. The first of all, if you see simple in Allen's keynote, it is written that it has a hemorrhagic diathesis and fluid blood and degeneration of red blood corpuscles. If you read that first line, it sums up that ammonium carb has a very, very important action over the blood, where it causes the blood to become fluid and degeneration of red blood corpuscles. So don't only think, like a lot of questions were asked about ammonium carb in relation to cough of old persons and snuffles of infants, and the patient gets up in the night, cannot breathe, like Sambucus. It's okay, it's there. But do remember ammonium carb for hemorrhagic diathesis, which we never think. We always think about those hemorrhagic remedies, the classical remedies like phosphorus and all, or the snake's remedies. But degeneration of red blood corpuscles, a very, very important remedy, that is ammonium carb. And of course, ammonium carb, the personality of ammonium carb, that as everybody knows, that stouty, fleshy woman with a lot of troubles in related to sedentary life, delicate women who have to keep that smelling bottle with them. This is degeneration of the red blood corpuscles. Degeneration of the red blood corpuscles. So see this wonderful line. That line sums up the whole concept of ammonium carb. If you understand that line and then read the remedy. So as you go further in your practice and you develop a lot of good results in your red blood corpuscles. Yes. So it is said that ammonium carb is a wonderful remedy for that. As you go further, it is said that ammonium carb, secondly, persons who are always carrying that smelling bottles, there are a lot of people in India, we see that they're always carrying that menthol containing substances, and they keep inhaling that. So woman, it is written carrying the smelling bottles. It is that also. And like sulfur, ammonium carb also has the same symptom, that the child dislikes washing. Like ammonium carb, think of antimicrobe and sulfur. So just see a remedy in a very broad perspective. Don't only think about one part of ammonium carb, that in relation to respiratory tract. Of course, it is there, but do think about the other side also, where ammonium carb has got very, very good results. Degeneration of red blood corpuscles. Mishraji, good afternoon. Good afternoon, Dr. Singh. So this was one of the questions in relation to ammonium carb, and of course, then you have that ammonium carb symptom in relation to menses, whether menses are too early, the profuse flow, and there's a lot of gripping colicky type pain before the menses, and there is a pain in the thighs. The thighs are very sore in ammonium carb, and there is a lot of fatigue, and there is yawning, there is chilliness in relation to menses complaints. Okay, so this is something about ammonium carb which you have to understand and read from your Mater Medica. This is one part which was asked very frequently about the cough of ammonium carb, but because I wanted to discuss something more about ammonium carb, I just told you some symptoms where you have to remember ammonium carb and read ammonium carb, so that you can get a very broad perspective. Second remedy, a lot of people were asking about antim-crude, antim-crude, and how to think about antim-crude and all. Of course, antim-crude, do remember the sentimental mood of antim-crude. Antim-crude, a very sentimental remedy, and it is said that sentimental mood in moonlight, and especially especially ecstatic lovers, and bad effects of disappointed affections. Now, this is very important. Bad effects of disappointed affections. Don't always think about disappointed love and then you have remedies, acid force and nitramure and calcarephos, but do think about bad effects of disappointed affections. I had a very beautiful case where the patient had just lost her dog, and because of that, she was feeling absolutely dejected. She thought that if she could take that dog to a veterinary doctor, maybe a few days early, she could have saved that dog. And after that, she became very dull. She became very sentimental. She used to sit, sometimes cry, make poem, talk like that. And anti-crude 1M single dose brought back life in that lady. So this is how that you have to understand that it is not always understand every word of Mathematica, what it is written. Disappointed affections. And then the whole case will be in front of you. Sometimes, we read a lot of symptoms when we understand, when we remember a lot of symptoms. But when we try to apply that symptoms, we cannot apply it because we have so many fixed notions about the remedies. So I always say, read the remedy first. Read the remedy first. However symptoms you can remember. आपने अगर थोड़े symptom भी उसको remember करे ना, तो it will be very beneficial. But you have to know how to apply that symptom. That is very important. Otherwise, anti-crude you can prescribe in corns, where the corns are horny on the soles of the feet, very sensitive. When the patient walks on the stone pavement, anti-crude is a wonderful remedy. But this disappointed affection, such a wonderful symptom of anti-crude, and I cured that case of anti-crude 1M single dose just because the lady had lost the dog. She was very sentimental, especially in moonlight. She used to cry, make poem, make poetries in rhythm. Anti-crude cured that case. Disappointed affection. So welcome, Dr. Burkar. Dry eczema, 2 spots on back, worst left, slight itching, frequently last 20 days, winter and damp weather aggravates. Now, whenever you are treating a case of eczema, make sure that, see, it is always said that skin is a mirror of sick image. Skin is a mirror of sick image. So whenever you are prescribing, I'll tell you the remedies, Dr. Singh, but whenever you are prescribing a symptom, a case of eczema, just try to get beyond that. Just try to get beyond the patient, and you will see that there are a lot of symptoms, there are a lot of hidden symptoms mentally, and the patient is very, what you call, mentally not happy with some situation, and because of that, the eczema has come up. So this is basically what I tell you, that skin is a mirror of sick image. But as you have asked the question, a very interesting question. Now, whenever you get a symptom that spots on the back, left side more, aggravation from winter, there are 3 or 4 remedies that should immediately strike. I'll tell you both the condition, Dr. Singh, when the patient is aggravated in winter, and second, the patient is ameliorated in winter. Both I'll see. So whenever you get a case where the patient comes and tells you that he is aggravated in winter and the skin symptom eczema, 3 remedies that you should remember. First is rust toxicodendron, second is petroleum, third is Delcamara, and fourth is Calcarea carb. Of course, Soranum is there, Miserenum is there, Mercury is there, Strontium calm is there, but I have got results with these 4 remedies: Rustox, Petroleum, Calcarea carb, and Delcamara. Now, sometimes you must know the reverse also. Sometimes you must know the reverse. What is reverse? Now, if you get cases where the patient comes and tells you that he is better, in the winter, and then there is a very important remedies, because we normally know the aggravation in winter. The patients who are the skin symptoms are better in winter, remember 2 remedies, very important. The first is Calibicrome and second is Sarsaparilla. Sarsaparilla, if you have not used for skin condition, you are missing something in your practice. I have always told something about Sarsaparilla, and I have got so many good results where sometimes Polycrest remedy has failed and Sarsaparilla has given me very good results. One symptom everybody should remember: skin eruptions or skin symptoms are better in winter. You must think about Sarsaparilla. Of course, in Sarsaparilla, you have that symptoms of emaciated and shriveled skin lies in folds. Skin lies in folds. You have seen a pug, PUG, pug dog. It's a pet dog. If you see his face, the face is in skin is in fold. That type of fold you see in Sarsaparilla, you see in Abrotenum, and you see in Sanicula also. These 3 are very important. Then in Sarsaparilla, you have ragheads where the skin is cracked of hands and feet. Again, Sarsaparilla. In fact, Sarsaparilla has rash from exposure to open air. See, such a wonderful symptom. Normally in open air, you should feel better, but a rash from exposure to open air is sarsaparilla, and dry itching comes on every spring and it becomes very crusty. That is sarsaparilla. But if the crust is of lemon color, then think about cicuta virosa. So this is how you have to differentiate a lot of skin symptoms and remedy, and then you will be able to be a better prescriber. Mishraji, next James will be going to helping as thalassemia. So what shall we do? Next genes will going to be happening. मिश्रा जी आपका सवाल नहीं पूछा, वायरल एज थैलेसीमिया, सो व्हाट शैल वी डू. मुझे आपका सवाल नहीं समझा मिश्रा जी, आप थोड़ा डिटेल लिखिए. Yeah, thank you, Dr. Singh. Yeah, good afternoon, Dr. Meera. So this is something very interesting I wanted to share about that winter aggravation. You know, there are a lot of remedies for aggravation, but emulsion also is important. मिश्रा जी आप सवाल थोड़ा अच्छे से लिखिए, मैं फिर से एक बार कोशिश करता हूँ आंसर करने के लिए. नेक्स्ट जेन्स will going to be happening. मेरे को समझा नहीं है. Viral as thalassemia. So what shall we do? Yes. So can we go further and have something more questions? Next generation going to be happening. Viral as thalassemia. See, जब भी हमको मिश्रा जी लगे कि वायरल या थैलेसीमिया बीमारी, ये सब बीमारी आप देखेंगे तो ये सब ये बीमारी क्या होता है? Okay, I'll tell you something about ससुरलप्पा, डॉक्टर बाबल. I'll tell you something. अभी क्या होता है मिश्रा जी, अगर जब भी हमको थैलेसीमिया बीमारी या ऐसी वायरल डिजीज जो बार बार आ रही है, तो वायरल डिजीज में तो मैंने आपको बताया कि जो भी प्रेजेंटिंग सिम्टम पहले है उसको ट्रीट कीजिए और उसके बाद पेशेंट का केस टेकिंग करिए, उसका ड्रग निकालिए, उसको दवा दीजिए. शायद आई डोंट नो, मैंने आपको केस बताया था. मेरे पास एक केस था वायरल हेपेटाइटिस. द पेशेंट वाज इन सिरोसिस ऑफ लिवर एंड to the surprise of the doctor also and the patient also, the viral load which was in lakhs has come to zero. There is no viral load. In that condition also I treated first the acute condition, then took the whole case and I prescribed the similimum, and I have not repeated that similimum for I think past 2 years, and the viral load has come to zero, which does not happen in cirrhosis of liver, viral hepatitis, you know. So Saucerella, I didn't find. Okay, I'll send you something about that, Dr. Weber. I'll tell you. Sir, foot and mouth disease in Goa. How to approach? Goa or goat? Yeah, Dr. Singh, skin is a mirror of sick image. Yes, thank you so much. So मेरे ख्याल से डॉक्टर अमित आप पूछना चाह रहे फुट एंड माउथ डिजीज ऑफ गोट, शायद ऐसे पूछना चाह रहे आप. Now, foot and mouth disease of goat, it is a very, very peculiar condition, you know. And I have seen many of cases of goats and where these symptoms will come to, you know. And इसके अंदर क्या रहता है कि हमको एक ही चीज देखना है, इरप्शंस किस प्रकार के. अगर आपको पता पड़ गया इरप्शंस किस प्रकार के, ऑटोमेटिकली आप प्रिस्क्राइब कर पाएंगे. बिकॉज उसमें कोई जनरलाइज कंडीशन नहीं है कि हमको ये इरप्शंस में एक ही दवाई चलना. देयर आर लॉट ऑफ remedies, you know, where you can get so many symptoms, but if you get a very, very important symptom, if you get a very, very important defining symptom of that particular part, then automatically you get that remedy. For example, see, whenever the patient comes and tells you, you see the eruption and you feel eruption is absolutely raw and very much threatening, ऐसा लगता है बहुत painful रहेगा. Immediately there are some remedies that should come to your mind. Hiparsulf, mercury, causticum, bovista, fluoric acid. Whenever you see that animal is scratching too much scratching, and then the part becomes raw, you must think about China, phosphoric acid, Rustox, Rusven, Sabadilla. Do remember the remedy Rusven. It's a very, very important remedy for skin itching, for foot and mouth disease of goat. And the mother and daughter keep coming for another remedy. Give tincture of Echinacea, berberis and calendula, but no result. What to do? I have a case of pandas, mycophonia, etc. T19, which is better on mental emotions, fears, tantrums, misophonia, but the acne is not. And the mother and daughter keeps coming for the remedy. She tincture, Echinacea, berberis, calendula, tincture, but no result. What to do? Yeah, एक बात, yeah, Dr. Alexander, sorry. So, one thing it is, if the disease is coming continuously, if the disease is coming continuously and the patient is, any other symptom any other symptom can you tell me about that, the lady? Any other symptom where, basically, misophonia. She's on calcarea carb. Okay. So we have a nice question, misophonia. Now I think whatever I understood about that disease is basically, it's a mental disorder where there is a problem in the sound, that, because of the patient cannot tolerate a specific sound or the associated stimuli, and that's a misophonia. If I can get the whole, no, if it is related to sound, if it's related to sound, there are other remedies which are very very close to this. Calcare is more in relation to darkness. So in it is basically, yeah. So it is basically, if I was the case, then you have to think about few remedies that are very very close in relation to noise, and the first remedy, I don't know, actually don't know, change the remedy. So you are stuck on calcarecab. Okay. So with calcarecab, do think about three remedies that comes to my mind. The calcarecab maybe I would place second. First is phosphoric acid, second is hyoscyamus, and third is calcarea carb. Think about those remedies. Vitreous detachment with microhemorrhage and tendency loss of vision. Retina is not affected. Would you recommend naphthalinum? Naphthalinum, basically, if you want to prescribe naphthalinum has basically very very specific symptom in relation to retina. In fact, if you have read naphthalinum basically covers all the complaints of the eyes. And if you see naphthalinum, it is written in the first line, remedy for retina problem. But can you elaborate some more symptoms? Because see, retina is not affected, there is hemorrhage. So we have to think of something more than naphthalinum. Any symptom which is much more than naphthalinum. For example, if you have your book of Boric Materia Medica, you can open naphthalinum. It is written that it produces detachment of retina. And in your case, the retina is intact. The problem is in the hemorrhage. So rather than prescribing for naphthalinum, you have to prescribe some other remedies in related to vitreous hemorrhage, because the retina is good. Whenever I prescribed naphthalinum, the detachment in the retina is very important, and there are deposits, patchy deposits upon the retina. Now that is a prescribing symptom of naphthalinum, rather than only prescribing for vitreous detachment and microhemorrhage. Okay, because the retina is not affected. That's a difference between prescribing this and this. Tuberculum throat symptom. Now, Dr. Amit, there are now see tuberculum basically. I think most of us basically have known some tuberculum that we use that remedy for intercurrent remedy for recurrent cough and cold. But I don't know. Yeah, the vitreous. See, there are deposits in retina, and then it is detachment. Then I would prescribe naphthalinum. Otherwise, the remedies, physostigma is there, phosphorus is there, crotalus is there, other remedies also there. That's what I have seen in naphthalinum. Yeah, now so throat complaints of tuberculum. Of course, I know only few throat symptoms of tuberculum, because normally tuberculum we prescribe either on the mind symptoms, or tuberculum symptoms basically prescribes an intercurrent for this complaints tendency to. But tuberculum, if you want to prescribe tuberculum, there is one or two symptoms in relation to throat which are very 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 important. First is hard dry cough from the throat during sleep. Whenever the patient is coughing, the cough is hard, the cough is dry, and during sleep, that is a very important indication of tuberculum. Second, there are rails and crepitations all over the chest. You just put your hand also, and you can understand that there are rails and a lot of rattling and crepitations in the lungs. That is also tuberculum. And third symptom in the throat, just look at the throat and the patients, you will find enlarged tonsils and expectoration of thick, very easy expectoration of mucus. These three symptoms I have found very useful in case of tuberculum throat symptoms and respiratory tract symptom very specifically. I had one case, patient ICU, 30-year-old, banker suddenly collapsed. She was unconscious for 2 days. After CT scan came to that there is a clot in the brain, and do we need operation or no? If there's only a clot, just send the CT scan report to me and we'll differentiate how much is the clot and where is the clot. Secondly, if the patient has collapsed suddenly, just ask the relatives what happened before that. Some symptom which has led to sudden collapse. What happened before that? Some mental trauma, some financial trauma, some career problem, some insult, some indignation, and then we'll be able to prescribe it betterly. But simple case, just a blood clot, we can think about arnica. You can think about arnica. You can think about arnica. Just sometimes by inhalation also you should get good results in arnica. So you can think about that also, arnica. But CT scan report is a must. She's on calcarea carb. Okay. Which is doing well in anxiety myso, all better, but the acne is not going. Okay, if the acne is not going, Dr. Alexander, the patient is better in the misphonia and anxieties, so you do need to change the remedy. And the skin is coming, so it is maybe Herring's law of cure. If you feel that it has to be taken care of, you might increase the potency and then wait and then see the difference. Just increase the potency and see the difference. You will get the change. Sometimes what happens, skin symptoms come and they stay. They cannot go. So just increase the potency, Dr. Alexander, and you will get the case. Okay. But it's a nice case. The patient is doing well, so don't change the remedy. Yeah, the parents may be pressing you. What we do in India, no? We give the patient placebo and then tell the patient to take this medicine just whenever before you start eating, or just take that placebo in hot water. In the night, take in cold water. Make the patient feel that she's taking something for the skin symptoms specifically, and it automatically happens that the patient is thinking that no, this medicine is for my acne, and automatically it will start working, because in your case, the calcarea carb is working beautifully. It has taken care of the anxieties, taking care of the misphonia. So it's a matter of time. Either increase the potency or give phytam in such a way that the patient feels that the doctor has given very specific something for my acne. So there is one question on the WhatsApp. Don't send on the WhatsApp because it becomes difficult, Okay, so I think it's in continuation with the same question. So as you go further, yeah, we have one question, so we'll see that question first. Yes, so in continuation with the same question, we have that when the eruptions are only on the joints, when the eruptions are there only on the joint, especially in winter. So there are few remedies again which are, we will think about. There are 3 remedies which are very, very, especially if you have eruptions. Yeah, good afternoon, Dr. Rakesh Singh. If you have eruptions in the joints, especially only in the joints, not in the body, think about rustox, think about mercury, and a very, very important remedy, sorinum. If you have not used sorinum, do open sorinum and read that remedy. It's a wonderful remedy, because what happens sometimes with a fixity of mind and fixity of a remedy, but what we have studied in our past, we generally think that sorinum is only good when we have to give an intercurrent remedy or anti-soric remedy, and then we prescribe sorinum. But sorinum, if you just open a simple book also, simple book, like for instance, if you just open Allen's keynote, sorinum is of course, if you open first line Allen's keynote, it is written especially adapted to psoric constitution. Or In next line it is written, in chronic cases, when the best selected remedy fails to relieve or permanently improve, then Soranam is indicated. Just don't think about Soranam in this condition. Now, Soranam has such a very important symptom, that is, there's great sensitiveness to cold air, great sensitiveness to change of weather. Even the patient wears a fur cap or an overcoat or a shawl, even in the hottest weather, and that is Soranam. You must have missed so many prescriptions just by giving mercurius or rustox. But if you have read Soranum, such a wonderful remedy, and of course the body odor has a very filthy odor. Even after washing, the odor does not go, and we normally then think about sulfur. But Soranum, carry on like odor, very very important. That is Soranum. Do read Soranum. It's maybe there are a lot of a lot of patients which needed Soranum, and you have prescribed some other remedies. Maybe they are better but not cured. I think one dose of Soranum should cure the case. It is also a very important remedy for acne. Acne is all forms of acne, either it is acne simplex or acne rosacea, aggravation during menses. Because whenever the word of menses comes, we think about remedies like pulsatilla or sabina or thuja or other remedies. We never think about Soranum. But when the acne rosacea or acne simplex, aggravation during menses, think about Soranum. Acne from use of coffee or eating a lot of sugar or eating a lot of non-veg, think of Soranum. This is such a very important remedy, Soranum. Do read this remedy and you will get very good results when the symptoms indicate this remedy. Also, simple hay fever, which appears regularly every year, the same day of the month. पेशेंट आके बोलता डॉक्टर साहब मेरे को हर साल ये महीने में ये दिन को मेरे को आई गेट फीवर, एंड इफ यू ओपन Soranum, it is written hay fever appearing every year, the same day of the month, the same day, what Dr. Allen's read, the same day of the month, that is Soranum. So do think about this remedy if you have not used. So I was just telling you some mater medica in relation to eruptions only on joints, especially winter, Soranum, mercury and rustox. If you open Allen's keynote, just below relationship, it is written, Soranum should not be given only for psora or psoric diathesis, but like every other remedy, upon a strict individualization, the totality of symptom, and then we realize its wonderful work. If you have Allen's keynote, do read this sentence, a very beautiful line written by Allen's. Then we realize the wonderful work of the remedy. It should not be given only for psora or psoric diathesis, but like every other remedy, upon strict individualization, the totality of symptoms. So do use this remedy. Sometimes we are very prejudiced in a particular remedy, and that's why we fail to appreciate these symptoms which are beautifully written in simple books. Okay? Yeah, Dr. Avni, good afternoon. So let's go further. Let's go further. Some few questions or something more about Soranum. Dr. Bell has written something very good about Soranum. He has written, whether derived from purest gold or purest filth. Remember this, just hear the sentence. Whether derived from purest gold or purest filth, our gratitude for its excellent service forbids us to inquire or care. This is written by Dr. I think P.B. Bell. Such a beautiful line, either made from purest gold or purest filth. Our gratitude for its excellent service forbids us to inquire or care. That's Dr. Bell. So, a very interesting remedy, Soranum. So, can we have further questions? All question answered. No question today. It's already half an hour, and Some questions might have scrolled up, so you can always have this. What's on the back of hand in crops, flat or on knuckles? Not many case, but save the picture. They are raised and read around. Okay, back of the hand. Okay, so remedies. I think you must be knowing the remedies. There are remedies. Remedies. Okay. See, whenever you are prescribing for warts, it is there are few remedies, which have warts on the dorsum. Now, as my material goes, anacardium, natrum mure, natrum sulf, nitric acid, and berberis also. Berberis also. Repetry, I don't know. Whatever knowledge of mathematics I have, so I've seen there are good results on the dorsum of the hand. Anacardium, berberis, nitric acid, natrum mure, sepia also. But in this case, do think about the type of wart. Flat wart or raised wart or horny wart or cauliflower type wart. This is also very important. If you understand that, it will be better, because then you'll be able to get the remedy very fast. Throat flat and raised. So you can flat and raised, think about anacardium, berberis, natrum mure. In crops, these three remedies. CPA is also there. Throat polyp worst in cold weather and better for rest. I'm giving Restox 30 and Populus Scan SOS. In how many months will be fine? See, in case of polyp, normally whenever we are treating a case of polyp and they are under treatment, normally I repeat a scan or an X-ray after 4 months. So wait for 4 months. If you think that your remedy is right, wait for 4 months and then repeat the scan. Precaution wise, it is very important to understand that if you're treating a case of polyp, if your remedy is right, I normally people say don't take raw onions and coffee, but I have seen that it does not matter what the patient eats. Homeopathy, if the remedy is right, it will definitely work. So don't worry about that. Of course, make sure that the patient does not have recurrent inflammatory disease, so that the body, basically the vital force basically has to work more. So make sure the remedy is right, that the body does not get recurrent inflammation and recurrent chronic recurrent throat problems, or so that the body is in harmony, and the remedy will work better. Okay. Let's go further fast. Chronic alopecia, sir, please say some remedies and any suggestions of investigation. Okay. See, alopecia, of course, alopecia also. First, let me be very sure when the patient is suffering from alopecia. And I don't know whether your patient is suffering from either alopecia areata or alopecia universalis. You will find a lot of cases of alopecia areata in children, school-going children, where there are patchy loss of hairs, and then you start prescribing the remedies and it works. Sometimes it works automatically, it comes automatically. I have seen alopecia areata in children, they have a lot of stress. It is all because of stress. And now you understand why stress in such a small child, in a school-going child. Stress of competition, stress of performing, stress of family. That means that the family is not okay, father, mother are always fighting, or separated parents. And the stress in school. Stress in today's world, you go in a school where there are people giving a lot of parties and XYZ, and the boy cannot afford that. So there are a lot of stress. So I've seen in school-going children, there are a lot of stress because of this, and the patient suffers from alopecia areata. There's one condition called as alopecia universalis. I have few cases of that, but let me tell you, few cases have recovered also, and few cases are in stage of recovery. But it requires a very, very important thing is the case taking. It is total destruction, So total destruction means total syphilitic case it becomes. Whenever if you are treating a frank syphilitic case, it is very important. It is very important that you have to understand why and what are the conditions which has caused destruction. For example, Simple, when you're taking a case that destructive symptom, like we say vindictiveness or the rebelliousness or that uh, shamelessness or loss of character, the syphilitic rubrics are very important. And be very sure that you take one or two main syphilitic rubric that enters that case. Don't try to get lot of symptoms and lot of rubric, otherwise you'll only get the polycrest. Syphilitic, that syphilitic expression is such an important symptom of a person in treating cases of alopecia universalis. Okay, I hope doctor, who is doctor, he has understood something about that. Dr. Taha, I don't know the name exact. So there are two sides I told you. See both the sides, because these are very, very important to understand. Otherwise, what will happen? There are a lot of symptoms of anxiety, emotions. He's not feeling well. He cries when he goes to school. He always thinks, what will the people say, X, Y, Z. And you repetize these symptoms of emotional remedy will come. But the syphilitic part, what is the syphilitic symptom in the patient's constitution, that if you think and prescribe, then one or two symptoms or one or two rubrics will solve the case. Arsenic in relation to kidney. Yeah. So you are treating a case of alopecia areata. You just at the age of 25, on the threshold of career, trying to make means to earn either by good career or by business. So the turmoil of stress of business or to earn or to support the family and then go for marriage is that turmoil. Ask that symptom, enter that case through that point, and you'll be able to cure that case. In relation to kidney arsenic album, I have seen a very interesting remedy for Bright's disease. A very important remedy for Bright's disease. And in urine, there are epithelial cells. In urine, there are epithelial cells and pus and blood in urine. Urine is very albuminous. That is the indication of what I remember arsenic alb in relation to kidney complaints. Of course, there may be other symptoms of arsenic alb in kidney, but these are the symptoms which I have seen. Yeah, you can send me the photo and I'll see what I can do. So I was telling something about arsenic album. These 3-4 symptoms I have seen arsenic album have given good results. Second important thing in arsenic album is the urine becomes scanty. The urine becomes scanty, and sometime when the urine starts becoming scanty, you think of some other remedies, but do think about arsenic album also. So these 3-4 symptoms of arsenic album are very, very important. As you go further, of course, this is in relation to kidney, but 2 or 3 symptoms which, of course, arsenic album is also very important remedy of uremia and kidney failure also. So this is in relation to arsenic. But 1 or 2 symptoms in relation to old age which comes to my mind. I have got very good results of arsenic album when there is atony of bladder in old persons. Simple case, it had come that the atony of bladder, we think about conium because it's a remedy for old age, but atony of bladder in old person is a very important symptom of arsenic album. And there is a feeling of weakness in the abdomen after urination. Feeling of weakness in the abdomen after urination. This symptom is also a very, very important symptom of arsenic album. One symptom, only I had about 2 or 3 patients in my life. One symptom of arsenic album is there in relation to that is the urine is sometimes black as if mixed with dung. D-U-N-G. Urine is black as if mixed with dung. That is also arsenic album. So these are the basic symptoms which I have seen arsenic album in relation to kidney. I hope that answers your question, Dr. Alexander. Material wise, arsenic album is a polycrest remedy, so there may be a lot of other symptoms, but these are symptoms which I have seen in my practice. Urine black, like mixed with dung, or urine scanty, weakness of the abdomen after urination, atony of bladder in old people, Bright's disease, urine albuminous, epithelial cells in the urine. These are the symptoms of, if you generalize this, of complaints of kidney. Yes, so can we have some more? Yeah, Dr. Taha. Jar, see, it's a simple thing, slight movement. That's all. You can say that. So can we go further for some more questions? One, if you don't have it, okay, early, Dr. Vinsa. Elderly urine incontinence, forgetful, fear of failure, of being inadequate, right eye, blurred vision. I feel she is calcarea carp types. Yeah, if you feel the patient is calcarea carp, so see, incontinence of urine, there are a lot of pathological causes also. Calcarea carp, see what happens, why calcarea carp comes in a lot of things, because in what happens in urinary complaint, there's problem in the musculature, and so calcarea carp will come. But if you see other remedies, like if you have never seen and prescribed for retention of urine or these complaints, you must think about remedies for paralysis of bladder. Causticum, very, very important. Pararia brava, very, very important. Calcarea carp, of course, it's there. But conium, gelsemium, these are very, very interesting remedies that you should always think about in these type of complaints of old age. And of course, then if you just open the book of Matermedic and you see incontinence, then you can have causticum, you can have equisritum, you can have sepia, macphos, graphitis, creosote, lofotrin. But these 4-5 remedies have given me very good results in cases of retention of urine, or sorry, incontinence of urine. Think about causticum, think about ferrum, think about gelsemium, think about calcarea carp is there, think about sulfur also. These are remedies which are very, very important in case of incontinence of urine. Especially if you want only for old age type, then there are 3-4 remedies for old age. One is conium maculatum, one is arsenic album, one is sepia, and the other you can think about rustox, more often in old ages. Okay, so can we go further? It's 3:45. We can take few questions more before we wind up. There's a question on WhatsApp. I'm not able to open it. Yeah, one more, same in relation to urine incontinence. There's one more question. The question is same. Do think about these remedies in old age, because if I have told you something about, there's a rubric in Fatak Repertory. There's a rubric in Fatak Repertory, dotage, and there also the first remedy becomes arsenic album. Okay. So is it okay? I think with all questions answered today, there are no further questions. So I think I think I've answered most of the questions. So let us wind up today. I think that's all for today. So thank you all for joining. If there are no questions, I can sum up today. Thank you everyone for joining. Until we meet on next Saturday for the same YouTube live. Thank you.